never had done really well is focused on the full picture, right? Really the whole thing, right? The whole longitudinal experience of those that we serve. And again, the health system, I call it the sick care system because I'll actually come back to that in a second, because of the way the journey happens. And so I'm not going to take a long time here, but I'm going to go real quick. So what we see is longitudinally on the experience here, if you take health status over time, and you think about somebody that's 65 or 70 or 72, that's actually their health status is okay, right? They might have some comorbidities, they might have some challenges, right? But they're medically managed. If I gave this person a persona, it was Betty, and she was 72, living in her own home in St. Paul. She has a dog. Maybe her husband passed away a couple years ago, unfortunately, but she's doing pretty well. She has some daughters and sons, grandbabies. She's doing well. They love her. She's engaged. So if we think of that, then over time, where she's at up on that higher health status, what happens to people, and COVID's a great example, unfortunately, what happens is people are, they're shut in, right? Betty hasn't been able to see her grandbabies for a year. She's basically been in her house kind of fearful. And as that, like everyone with that experience, she gets a little depressed. I mean, we all get depressed, but with Betty, when she gets a little depressed, she stops eating like she normally would. Then because she's not eating, some of her stomach, some of her medications upset her stomach. So she stops taking her medications, and you guys know what happens, right? She maybe gets dizzy. She gets up in the middle of the night for a glass of water, and boom, she has that crisis down in that bottom of that curve, that first crisis point, that hospitalization event. And this is where our healthcare, kind of our acute care, goes into good motion. Like we're good at like getting people into the ER and fixing their hip. And she goes to the hospital, 7 days there, fixes the hip, goes to the SNF. 14, 17, 20 days in the SNF. Her family has to fly in from out of state. The thing is, she's getting better. She's really passionate to get better. And so she's working her rehab. She gets up to a point where, she gets discharged back to home. She might get some skilled Medicare home care. And as soon as she reaches kind of her potential, then the services go away. The family goes away. And here Betty is, maybe 75% of her baseline. And she kind of feels better because she's had some people around her. She is back in her home, but she's using a walker. And she doesn't like that so much, and she's still shut in. And what really the travesty is, we never go back and look at the root cause problem or really deal with the real problem. We deal with kind of these symptoms. And so what happens is no one's fixed her loneliness or depression or her sadness. And so now she's kind of feeling like, okay, now maybe she gets a cold that exacerbates her CHF, and she starts filling up with fluid, and she's unlikely to call out for help because she already just burdened her daughter. She burdened the system. She doesn't want to go back in the hospital. She's fearful of maybe being facilitized. So she doesn't call out for help. And this time, on this next hospitalization, how it happens is her neighbor comes over. Her one neighbor who sees her on a regular basis still with a mask, comes over for morning coffee and finds her face down on the carpet. She goes 911. So you guys get the picture here. This is what's happening to so many seniors. And over the last 10 or 12 years, it's obviously become more in the forefront because we've started to affect payment reform with, hospitals having penalties for rehospitalization rates. And that's become more of a problem to solve, and data and analytics for managed care, and, HMOs and PPOs going to ACOs, going to MA, Medicare Advantage, going to, full capitation with direct contracting. So the world's really opened up, but the problem still is the same, is many of these seniors, 1 in 5 people are still being rehospitalized in 30 days, 1 in 3 in 90 days. So it's happening to so many seniors. So anyway, real quick, this is everybody likes to be a reader, I hope. And, obviously you guys are coming out of your academics or just coming out of your schooling. This is sort of the villain in our story, right? The protagonist and antagonist thing. So this is kind of the backdrop. So the point is, what do we all do about this, right? How do we solve for this? And, LifeSpark has a perspective on this, but what we really wanted to do before we solved was go one step deeper and be the Simon Sinek. Somebody I saw in the chat talked about Simon Sinek, and he's a big hero of mine as well because he's all the why guy, right? So the issue here is like, well, why does this, I might not be that smart, but I can ask questions and be curious, right? And all of us need to always do that again, to be thinkers. The why or why does this happen is really, it's a couple different big things that many people know, but we don't even really dig into. So obviously the aging population is growing. It's going to double by 2030, and everybody knows that. We know our GDP and all the facts and figures are, 20% in the next few years. All those facts and figures you guys know about. So I'm not going to bore you with that. But what's not so boring is when you think about why this happens to so many folks. I like to look at it in a few different ways. One is because, we've really changed. Our society's changed socioeconomically, right? When you think about who used to care for mom or dad 50 or 60 years ago, it used to be the adult children would be in a town, right? So geographically, we'd be more tight, right? Now people move all over the place. So from the standpoint of the socioeconomics, oversight doesn't happen by the family as much. The other part is we have, it was traditionally, the adult daughters were a lot of the ones that had this burden, and they still do. And unfortunately, now all of our adult daughters are working. So now they're supposed to be working, be a good wife, be a good, a good caretaker for their elderly parents and loved ones. And it's unattainable, right? So that's happened. Plus, we've geographically spread all over the country. So there's these things that have happened over a period of time that have created oversight issues. And then we think about the care side, right? We think about, when I grew up in Wisconsin as a small kid, I had family practice, and Dr. Jensen was my doctor, and Dr. Jensen was our family doctor, and he delivered me, and he took care of my broken arm, and he took care of me when I had pneumonia. And we went from family practice to primary care, which is a good thing. And I'm all about primary care. The only problem with primary care, we went then to specialty care, which has a lot of great things in it. But what we lost is that longitudinal experience for people, that oversight, that person that was kind of there to be a really strong guidepost. The average, there's different data on this, but the average primary care interaction with a customer in the country right now is about 16 minutes a year. So that's another factoid for you. So that, 16 minutes a year, how in the heck are you supposed to really help somebody and be their oversight and avoid this roller coaster with just that? So that's a problem. And obviously the big one, as we all know, is payer. If you ever want to know why something goes round and round, it's always because usually of the payer. And, what's really great with the Affordable Care Act and the innovation that's happened and the opening up of payment and payment reform to really be at risk is for me the most exciting thing in the world as far as timing. Some of you might have read the book Outliers. Our timing, and you guys are perfect because you guys are the generation that's going to actually have the most amount of time to really dig in and solve these big macro issues. But payment has always been about acute reactive care, right? Mostly when we don't have preventative, pre-op, proactive. And again, I'm broad brushing here because there is some things, but for the most part, most dollars that are spent in what we call healthcare are not health related, they're sick related. So it's sick care, not health care. And it's a preponderance of the dollars. And so when all those dollars go into sick care, imagine, payment is a reward, right? If you reward something, it's a rhetorical question. What are you going to get more of, right? You're going to get more sick care. And so that's the whole dilemma of, health systems talking about, 1 foot in the canoe, value-based and fee-for-service, and I need heads and beds, and all these things that people struggle with, right? Trying to do the right thing, but being perversely influenced by a payment system that rewards the exact things that we're all trying to avoid, which is sick care, right? We want people to be healthy and well, not sick. So with that said, that's why it happens. It costs a lot. It costs a lot to families. It costs a lot to the client. Most importantly, we see a lot of clients that in my world and home where they're doing quite fine. And then 2 years later, they're down into this deep, kind of institutional setting, which is really sad, right? And so that's the saddest part. The families take a huge burden, right? We're trying to do the right thing with our moms and dads and elderly folks. And that's a burden, right, that we all hold. And then obviously from an economic standpoint, it doesn't matter what side of the political fence you sit on. None of us want to spend 20% GDP on outcomes that are not really creating great experiences. So with that, I just wanted to share with you how I see the world and how our company sees the world and how we all should see the world through this lens of how do we affect this longitudinal experience versus kind of take another chop, another slice, into take advantage of a business case, but not take advantage of the experience case, right? So that's the message here, right? So just for time's sake, I'm going to keep rolling here. Next slide. Morgan's putting that up right now. So this, in a really quick nutshell, is what LifeSpark's really focused on. And it doesn't matter about LifeSpark, but so I'll just really go through this quickly. But we really think the trust and relationship, that is the most important thing. That's why that's a gold ring around the client. Like whoever we serve, it could be, obviously all age folks here again. For us, we see the combination of high touch, high tech. It's really not one or the other, but it has to be both. And you guys know that. So what we do is we want to really have an intimate relationship. To know someone holistically is really, really important to us. And that's where obviously there's a lot of dialogue now, and everybody knows there's a medical structure, but the social determinant structure, the psychosocial, the behavioral health, right? People are starting to lean into that now because people are having to go at risk for longer periods of time. So for us, we've always been there. And so it's always about building this relationship. We call them life managers, right? So that's a holistic kind of approach, architecture. It's people though, meeting people, boots on the ground. So there's a boots on the ground element here for lighter, more wellness and more content curated driving experience and driving education and activation and engagement. We have life advisors. So we obviously have to look at the cohort that we're trying to serve around population health, because that's really what we're trying to do. And then obviously we have to have a partnership with primary care, with the nurse practitioners and MDs to really work together on this experience that the client wants, not the experience we want them to have, or not solving, a chronic or an acute event, but really how do we really prevent and really look at this proactively, longitudinally? How do we look at it from the eyes of those that we serve, from a true discovery standpoint, not assessment, right? We're not assessing everything. We can't assess everything on our own without really exploring and listening, and then building life plans and then fulfilling on those life plans. So for us, it's the architecture is that LifeSpark experience, which is a process. And then on the bottom, I know there's a lot of technology people on here because that's where there's so much opportunity for innovation. And I believe strongly that it's now the time again that we actually can use this technology in an effective way. To not only on data and analytics and get to things like AI over time, but really blending the medical, the payer, and the social determinant kind of information about people to really understand that experience better. And we call that an electronic life record. So we're pulling in multiple different feeds from EMRs, because everybody has EMRs, right? But this is really a data lake that's created to really pull not only the EMRs, but all the payer data and all the boots on the ground data, as well as all the social and psychosocial data that can be found. Ultimately then to drive towards an on-demand virtual delivery system, right? And so that's really the idea behind LifeSpark. So that's how we've looked at solving that problem of basically knocking that roller coaster. We can't obviously avoid all those acute events, right? Things are going to happen to folks, but if we can avoid a few of them and think more positively about helping people engage in their own trajectory, their own journey, that's what gets really fun. And that's what we're all about. So that's the slide there. And it's all about that experience. I just wanted to share that with you. I think this is just again, just for time's sake, this is just a representation. This is Bob. So it's always good to talk about data and emotion, right? I think it's the genius of the AND. You can't just have data and medical, or you can't just have science. You have to have the emotion, our limbic system. So together they're really cool. And so Bob represents sort of the outcome of really focused on people's experience and really thinking through really complex issues. Bob, by the way, this gentleman we've known for years. We met Bob when he was in independent living, and his wife, and we serviced them a little bit in independent living. And as he needed to move into more of an assisted living environment, because he was unfortunately afflicted with cognitive impairment, some dementia, we stayed with them, and we knew their family well, and we knew him well and what he really cared about. And as unfortunately, as he continued to age, his wife had to make a tough decision to move him from assisted living into a memory care unit. And as that time was really tough for her, we were really thinking about Bob and what really we could help her and help Bob and really their passion and really living. And so one of the things that we knew about Bob and that she knew about Bob was his passion. Everybody's got their thing, right? For Bob, it was amusement parks for whatever reason. I mean, some people like planes, some people like other things, but he liked amusement parks. And so as we thought about Bob and we thought about his experience and what we could do for Bob and what his life plan looked like, beyond all the medical things that we were dealing with Bob, we thought, boy, let's see if we can get him out to Valley Fair and just walk him around. And the plan was, and these are the pictures in the bottom, there are a couple of our nurses actually. We thought we'll get the wife and we'll get Bob and we'll just go walk around Valley Fair for an hour or so, and he'll get to see the rides and it'll be cool. What happened was unbelievable, right? Because of the empowerment and the thinking and the test pilot nature of our people, they got out there, and Bob said, I want to ride that. And by the way, this gentleman now is like, early, he's beyond early stages of dementia. I mean, he knows his people, but kind of, and he's kind of, he's kind of in and out, right? Just to give you context. And he's like, I want to ride that ride. And our nurses were like, holy crap, my license is on the line. What do I do here? His wife was there. We talked about it. They talked about it. And they're like, all right. So they got him on one of the kind of minimalist rides, right? Something that was easy and not a big deal. And then he's like, I want to ride that. He want to ride that. And sure enough, they started taking him into these really crazy rides. And actually, Bob, through the day, rode every roller coaster at Valley Fair. He was they bought him some shorts and they got him in the lazy river 3 times. He slept, as you can see down there. He had ice cream twice. I mean, this guy, it was unbelievable, the experience that Bob was afforded, and that not only that he was afforded, but the people that were serving him were afforded, right? I mean, imagine, really being able to be a nurse or be somebody that just cares, right? And so that experience for Bob was powerful, but it wasn't a one and done. It wasn't a one and done. It wasn't just a wish, right? It was really then what happened is they took those photos and all the experiences that Bob had and they put it in scrapbooks. And to this day, that's what they use to redirect Bob. He has some behaviors, he has some challenges in his experience, but they've taken those experiences and those important aspects of that life plan to use that not only for his wife, but for him and for those caretakers to bring that spark and that liveliness back into Bob's experience. So anyway, just wanted to share kind of how it can come to bear. And we have hundreds and thousands actually of clients that are like Bob, that sometimes they're little teeny things, sometimes they're big things, but we never miss on that focus that opens up really into that experience for Bob and for his family. And then ultimately into those that serve. So again, I'm kind of going fast here, but wanted to just jam with you a little bit on this stuff. I think, as far as, maybe the next slide here, as far as, takeaways, I think all of you out there are looking at this market and looking at opportunities. And I would just call out to all of you to say, look, nursing skills and your professional and your technology skills are critical right after you have a great sense of humor, right? And so this is an actual ad that we're using to recruit. And so you guys can jump off and use your own thinking, obviously, and how this plays to you and your role to really serve in a really cool way and in a fun way, and then most importantly, in a meaningful way. So again, going back to that opportunity that you guys have right now in the market is unbelievable. I'll just say a couple last things about that. I mean, being in this for 30 years, I had to be sort of more of a marathon man. I didn't have a payer to work to. And now the payer world is opening up. And by the way, like LifeSpark, we're doing global risk on populations now. And we're a home and community-based provider, right? That would have never happened, could have never happened 5 years ago, 10 years ago, 20 years ago. Technology, the use of technology and the integration of all this data, which people are hungry for in unique ways, is unbelievable, right? I mean, it's been talked about, back 10 years ago, I've been watching technology. There's a lot of plays on technology, but I believe, it's not technology for technology's sake. It's integration and partnerships that matter. And so how do you work into that experience, that journey map for these populations with technology? So technology is better than ever. And the obviously, the need obviously has never been stronger given the population and the movement of our folks. So with that, I just don't want to go too long here. I know I'm about 30 minutes right now. I just want to say, never settle in your career. Address, really what's important and authentic for you. Be the Simon Sinek, be the why person. Even if you're, for me, I'm not the smartest guy. I'm sure there's many of you out there are way, way smarter than I am, but with a good will and a good heart and being a why guy, maybe not a wise guy, but a WHY guy. I've been curious enough to learn enough to continue to move our bus forward and move a lot of people forward. And I just continue to look to do that. So I would love to continue to partner. I know there's a lot of great partners on this call, and that's really what it's about, is creating this movement, again, advancing care in the home. It's really cool. You know, I don't want to get into any more right now, but, you know, we've done hospital at home, SNF at home. You know, there's the home is obviously where people live 99.9% of their time. And so I love that you guys have this theme and that you guys are going to be able to play off this for the next couple of days and hopefully the rest of your careers. So with that, thank you again for the opportunity.
Starting at 8, we have a lineup of 4 30-minute talks. So they will all cover sort of the advanced care at home theme that we've set for this event. And then starting at 10 a.m., that will be time for you all as participants. If you were inspired by any of the talks this morning, or if you came with an idea, you can pitch that to participants in the room. And that is an opportunity for you all to sort of find teams that you'll be working on throughout the weekend. So if someone pitches an idea that you're excited about, go send them a private message and find where they are, which table they're at. And we hope that the tables will allow you to work in groups efficiently. And then from 10 a.m. today until 1 p.m. tomorrow, you'll be innovating, coming up with maybe a software prototype or coming up with a business proposal and maybe present some slides on it. Either way, with whatever skills you have on your team, just try to come up with a disruptive solution that addresses sort of an unanswered problem in healthcare. And starting at 10, it will be 4 to 5 mentors present at any time to answer questions. And these mentors have expertise in business, healthcare, and technology. So we hope that they'll be able to sufficiently troubleshoot or guide you in your journey as you kind of make your way through this event.
Thank you, Morgan. Thank you, Joel, for the engaging keynote. Can you hear me okay? Something in the chat, maybe I can't. Yes, thank you, sorry. So Young-Han actually touched on some of the points I was going to make and just about how the event will flow over the course of the weekend, but I still have some prepared comments I wanted to share. Welcome, everyone. Thank you for signing up to spend your weekend innovating healthcare with us. My name is Patrick Zumo. I'm a health knowledge architect at Mayo Clinic and also a member of the multidisciplinary team that worked to organize this event, the inaugural Mayo Clinic Health System Innovation Sprint. Nearly 100 participants registered for this event, though it seems perhaps not that many have signed in just yet. We hope they come by. Throughout the course of the weekend, we'll be mentored by about 20 mentors that bring a variety of experiences and areas of expertise and specializations to us, to the event, to share with you and help guide your projects along. Final presentations will be evaluated by a panel of 4 judges. The top 3 highest teams will be awarded prizes, and we'll share a little bit more information about that in a moment. The purpose of this event is to help encourage and facilitate collaborative innovation with your fellow participants and Mayo Clinic, the #1 ranked academic medical center and hospital in the world. Participants will work on ideas primarily related to Mayo Clinic Platform's Advanced Care at Home initiative. Participants will hopefully form interdisciplinary teams. So that means, for example, IT experts, application developers, nurses, doctors, engineers, and students. You will share ideas, pitch healthcare pain points and problems, develop solutions to the extent possible throughout the course of a weekend, which we know is a limited kind of scope time. That's where the fun comes in. And you'll work to advance education in the healthcare domain. The schedule for this weekend's on our website. And again, just as a reminder, we'll post that in the chat and just share that with you so you can check it for reference. But again, Young-Han touched on it. It's published on the site. We're available certainly if you have any specific questions about it. But I did want to clarify a couple of other points or share additional information. So for pitching, those pitching ideas or pain points will be allotted 2 minutes for their pitch presentation. And then for tomorrow, when the teams make their final presentations, they'll have 5 minutes to make their presentations to the audience and the judges. And then in terms of prizes, first prize gets awarded $2,500, second wins $1,500, third prize wins $1,000. I'd like to share with you a quote from Dr. Charlie Mayo. If we excel in anything, it is in our capacity for translating idealism into action. That simple quote really, I think, succinctly captures the spirit of this event. I hope that it might inspire you throughout the weekend. Think big, be idealistic, most importantly, have fun and enjoy yourselves. Thank you.